Hey, what's up guys? This is Luke with the Live Great Lifestyle. Today I'm going to show you a quick and easy way to help you out if you've ever tweaked your back when you're lifting. So in the past I've worked in rehab studios with chiropractors, so obviously I saw lots of low back patients. This is something I've personally used in the past, having compressed the disc. Every once in a while it may flare up or I might tweak it. And again, I've worked with lots of clients who come to me because they have low back issues. Now, there's going to be some bigger global fixes to address movement patterns, but this will help you unload some of the tight tissue and hopefully get you up and moving if you did tweak that back. Again, to really fix it, you're going to have to address movement patterns and some strength issues, but this can absolutely give you some relief from acute pain. So we're going to start with a lacrosse ball or some type of soft tissue ball, and all you're going to do is you're going to bridge up and you're going to place that off the side of your spine, and you're just going to find any tight or tender adhesions. And keeping my abs tight, I'm just going to push and kind of mash around on those tight spots. So I can go up and down my spine, not putting it on my spine, both sides. And honestly, you could probably stay on these spots for anywhere from 2 to 3 minutes, pushing down, just trying to get that tissue to relax. So after you've gone up and down the spine, again, this is for low back, we're going to remove the ball and we're going to go into some pelvic tilts. So all we're going to do here is, right now we have this natural arch in the spine. We're going to drop our pelvis to the floor or our low back to the floor and get rid of that arch. Hold it for 2 or 3 seconds, and we're going to come back out the other way. And again, push the lumbar down to the floor and then back out. I like to do this about 10 repetitions. So all we're doing with that is we're going through some flexion and extension in the lumbar spine. After we've mashed on some of that tissue, we're now going to stretch and shorten that tissue. From there, we're going to go into cat-camel. It's the same idea. We're going to lengthen and shorten those muscles that we just released, but we're going to do it to a bigger degree. So your knees are below your hips, wrists are below your shoulders. You're going to tuck your pelvis as you tuck your chin and arch your back. That's going to be a big stretch in those muscles. And then we're going to come the other way where we're going to rotate our pelvis up or kick our butt up in the air and pull our chest up. Back and forth, nice and smooth and controlled. Again, I'm going to do cat-camel for 10 repetitions. Again, we're just trying to lengthen and shorten those muscles that we just mashed. Back onto our back, we're going to bring one foot up, and then all we're going to do is very slowly, keeping our abs tight, we're just going to start to bring our knee down and then our foot back. And all we're doing is letting our body know that it can go into a little bit of this rotation, and it doesn't need to freak out, or those muscles don't need to go into like the spastic contraction. Again, you're not trying to slam your foot down, just a little bit of movement, but make sure your abs stay tight. Remember, the lumbar spine isn't really about rotation, but it should be able to move a little bit. So we're just going to kind of coax that back and forth, letting our body kind of realize that it doesn't need to freak out in those positions. So after that, we're going to unload the whole posterior chain. We're going to do hamstring, calves, and then most importantly, the lateral line of the leg. You want to do it in this order though. Really the last one is where the magic's at, but if you don't do the 2 stretches before it, you won't get as much out of it. So you're going to loop a band or a rope over your foot. Abs are on tight, and all you're going to do is you're just going to lift your leg up to your end range of hamstring. So your knees completely straight, hips are square. If this is as far as you can go because of hamstring tension, stop there. If you can go further, take it up to your end range, and you're just going to hold for 3 or 4 seconds, keeping abs tight, and then you're going to lower it back down. Then you're going to bring it back up, and you're just going to repeat this 8 to 10 times. This lowering down and then bringing back up. So now we're getting a good stretch for 4 or 5 seconds, but then we're giving it a chance to relax. From here, we're going to go into hamstring. We're going to pull calf. We're going to pull the toes down towards your face. Knee is completely locked. You're holding at your end range of hamstring. pull your toes down, hold for 4 or 5 seconds, and then you're gonna relax it. Again, pulling down, 4 or 5 seconds, and relax it. Again, you're gonna do that for 8 to 10 repetitions. The reason I like this 4 or 5 second contraction, it gives you a good stretch, but then when you relax, you're not gonna go into this really kind of freak out mode, which maybe you might when your back's a little flared up. All right, the last one, keeping your hips nice and square, knee completely locked. You're gonna bring it up to that in-range hamstring, and you're gonna pass it over, and you should feel a big stretch all the way down the whole lateral line. And this is the one that really will tie into the lumbar and give you some relief. But if you don't do those other stretches before, you won't get as much out of this. So again, holding for 4 or 5 seconds. Try to keep your hips square. If you do this and you roll, you're not really getting any of the stretch. You gotta try to keep your hips square and actually cross that leg over. We're gonna get that whole lateral line on the posterior chain. Okay, from there, you got 2 anterior muscles we're gonna stretch. We're gonna stretch a quad head, and then we're gonna get the psoas being this deep hip flexor that does connect to the lumbar spine. So for the quad, you're just gonna bring one foot up on a box, a chair, or your couch. Other foot's gonna come up. Hips are completely square. You're gonna pull your pubic bone up and your tailbone down. You're gonna rotate your pelvis. Squeeze the glute of the leg on the box. We're gonna raise up. We're gonna hold this one for anywhere from, again, 1 to 3 minutes. We're gonna camp out in this position. Put something under your knee, like a pad or a pillow or a towel. You should feel a big pull. Again, hips are square, pubic bone goes up, tailbone goes down. We're drawing in, squeezing the glutes, big quad pull. Switch sides, do both legs. The last stretch is gonna be the psoas. The psoas is a deep hip flexor that actually connects to the front of your lumbar spine. So oftentimes just getting this muscle to stretch can help with some lumbar pain. Staggered stance, both toes are completely forward. It's important that your heel's on the floor with the back foot. You're gonna rotate the pelvis. Pubic bone goes up, tailbone goes down. Squeeze the glute of the back leg. As I draw my belly button in, I'm trying to draw my ribs up, and I'm reaching for the sky, but I'm not reaching through my shoulder. I've maxed out that distance. I'm reaching by trying to draw this muscle right here up. So as you pull in and lift up, you should be able to hook or anchor on this muscle here. Make sure you're not just leaning back. Draw in and try to raise up. You're gonna hold again for this one. I tell people if you can hold it for bouts of 20 seconds, that's probably your best bet because it's a really easy muscle to slip off of. So hold for anywhere from 20 to 30 seconds, 3 or 5 repetitions. Do that on both sides. I'll have people who, honestly, they'll be in pretty severe pain, and just by going through that whole process in a matter of 5 to 10 minutes, they're back up, they're able to get tall, and it can release and help with a ton of lumbar pain. So that's how to kind of deal with if you've tweaked the lumbar and to give you some relief from any acute symptoms. Again, there is some strength issues and some movement stuff that probably needs to be addressed in the long term, but this hopefully should help you out with some acute pain. All right, take care, guys.